pediatrician offices are set up to be vaccine clinics. So a pediatrician's office cannot sustain a business without pushing the vaccines. It is really a vaccine market for them. They have quite the incentives to have a fully vaccinated pediatric population of patients. So not only—
Can you talk a little bit about those incentives? Like, how does that work? What are they? Sorry.
Right. So first of all, the insurance is giving them compensation for just an administration fee. So they're given some money from the insurance companies, reimbursement for administration fee. On top of that, they give them a, for every adjuvant, per adjuvant basically of a vaccine. So if you have the Tdap vaccine, you have 3 in 1. So that's 3. So the first one is about $40, and then the consecutive ones are about $20 each. So that vaccine alone would be $40, $50, $60, $70, $80. And then they're given multiple vaccines on that same visit. So say the 2-month vaccine visit, right? You're given 6 doses of vaccines, and that equates to about $240 worth of just the adjuvant amount. On top of that, you're given an administration fee. But there's also something bigger than that. They think of like car insurance, right? If you're a good driver, you're getting a better rate, right? The same works for medical insurance and reimbursements for good behavior. So if you have 80% of your practice that is getting all of the vaccines, you're getting incentivized for every single reimbursement that you get. You have a good record as a good provider, and therefore you're getting more reimbursement for all of the things that you're billing for through that insurance. So a good practicing pediatric office gets about $1 million a year just in fully vaccinating their population of patients.
And that sounds like they're incentivized to kick out the people that don't want to get vaccines.
Absolutely. Right. And doctors are given, they're given courses on how to persuade parents in a variety of different malicious ways, and are not actually given information about what's in the vaccines, what are the adverse reactions to the vaccines. They're just given a piece of paper that they're to give to the patient and to incentivize them any way they can, coerce them any way they can to get them to comply and take these vaccines. And the behavior is absolutely abhorrent. When a parent really wants to come in and have a true discussion about it, any parent would know, if they've already done this, that a pediatrician's office, whether it's the staff, the nurses, or the pediatrician, are going to gaslight, they're going to shame, they're going to try to embarrass, they're going to even threaten to remove them from their practice, no longer getting appropriate care. So, and our family, even after our kids were vaccine injured, my child was having seizures, we got booted out of our pediatrician's office because I refused to vaccinate them anymore, even though my child's neurologist said you should never, vaccinate her with this particular vaccine ever again. So this is going on, and the fear that parents have is that how am I going to get appropriate care? A lot of people don't know that before the 90s, pediatricians were only used for kids that were like very high risk medical needs. And then you just go to your regular family doctor. Family doctors are trained to treat all ages. But then when we moved into this vaccine era, the vaccine manufacturer companies came in and said, we're going to set up a business model that gets more patients to you. And that's when they started setting up the pediatric schedule, the wellness visits, 2 months, 4 months, 6 months, 9 months, 12 months, and on and on and on, getting patients to come in. They get all this reimbursement and they get incentivized by the insurance companies. It's quite a racket. And our kids are being harmed in the process.